Sports injuries. Sports injuries are more common today than in the past for many women athletes. Injuries are an increasing problem in women's soccer, and gender differences contribute to the outcome due to anatomical, physiological, and psychological differences. Some solutions to the problem include proper strengthening of muscles, reduce overload on the body, and decrease stress. Um, Sports are important to many people at any age because sports provides a sense of belonging to a group and friendships are formed along the way. So it allows people to stay out of trouble and create friendships that they might not have without a sport. So some evidence, so looking at the anatomical differences, uh, decreased lateral hip control is often seen in females, and that's why they're at an increased risk of injury. Decreased hamstring activity occurs within them, slower reaction times, decreased flexion angles upon landing, and decreased core stability. And they also have a narrower femoral intercondylar notch. Uh, so women are built completely different than men. So if women focused on increasing hamstring strength, so the quads and hamstrings fire at a 2-to-1 ratio, increased hip control with abduction exercises, and increased hamstring flexibility, women would be at a they could decrease their chance of injury. And having these different anatomical differences, uh, this puts more strain on the knee, causing knee valgus. That's what the picture on the right is showing, and that's why most ACL tears occur. So also not a lot, also with anatomical differences or our hormones could affect increasing injuries. So a normal cycle, as you see, the hypothalamus releases the gonadotropin releasing hormone, the pituitary gland releases the follicle stimulating hormone, and also the luteinizing hormone, and the ovaries release estradiol, progesterone, and testosterone. When one system doesn't work, it creates a chain effect and it can be thrown off by improper nutrient intake. So they found, increased knee laxity or looseness occurs. They found close to a woman's ovulation in the menstrual cycle, you have a looser knee or knee laxity. Um, so this can cause female increased injury. Stress is also why females have an increased rate of injury. Stress constantly overstimulates the body in reaction mode, um, and it wears the body down. Stress does not allow the body to heal itself, so stress affects attention, decision making, muscle tension, stuff like that. Some alternate solutions that people looked at to solve this problem, they looked at the extrinsic factors, so smaller and lighter ball, a program called Harmonic Knee, and performance isokinetic tests were performed. Even though reducing the size and weight of a ball might put less strain on the body, an athlete will still have to endure the other mechanisms involved in an injury, like how a person plants their foot to kick a ball, that relates to their anatomy and bone formation. The Harmono Knee program, it's a program that provided a structured warm-up, so it included 5 things: a structured warm-up, muscle activation, balance, strength, core stability, and this was performed 20 to 25 minutes 3 times a week before training to loosen up and activate the muscles. I think the Harmono Knee program is beneficial, but no warm-up program is effective if the human body is not in alignment when looking at formation of bone and hormones. And then the performance isokinetic tests assess the risk of muscle injury within an athlete. So even when isokinetic tests are performed to assess the risk of muscle injury within an athlete will take the information with a grain of salt. If an athlete is not currently injured and the tests come back stating they are at an increased risk of injury, they will still do the sport they love. Sometimes tests can be faulty, so it might not be 100% accurate. So like I said, if bone alignment, hormones, and stress are not functioning like they should, no warm-up strategy or no specific extrinsic factor will benefit the athlete. So some of my solutions looking at the intrinsic factors are proper strengthening of muscles, reduce overload on the body, and decrease stress. So looking at proper strengthening of muscles, they did a study, 205, 9 out of 205 athletes tore their ACL, and they noticed in the 9 that their knee abduction angle was greater at landing and 20% higher ground reaction force, which this is related to severe knee valgus, like I stated before. Reduce overload on the body. They saw that active recovery is actually very beneficial for athletes to decrease the risk of injury, so proper cool down, stretching, muscle relaxation after physical activity. Too much overload on the body can cause poor rest, poor boredom, and overall soreness. So doing these things will help decrease the risk of injury. And decreasing stress. If an athlete evaluates the situation stressful, say competition or a game, that's very stressful. So that in turn increases muscle tension and increases heart rate. Not allowing the athlete to put full attention to the task at hand, like their sport, at the time being, that will increase injury because tunnel vision occurs and loss of focus occurs as well. So if they aren't able to put all their attention toward the game or toward practice, that increases their chance of injury. So sports injuries are very common in females, more common nowadays, and that's due to anatomical, physiological, and psychological differences between men and women. So what can you do as a listener or a reader? You can look at your current stressors that might be present in your life and try to decrease them. You can also get blood tests done to look at your hormone levels to see what's high, maybe what be low, and incorporate strengthening exercises, and reduce training volume. Every injury is not preventable, but there are factors that can be implemented to reduce the number of occurrences that in female athletes.